The U.S. Centers for Disease Control and Prevention has awarded a $3.4 million grant to a coalition of New Haven community and higher education leaders to address racial and ethnic health disparities in New Haven. Yale School of Public Health professor and pediatrician Dr. Sten Vermund is here today to explain how the money will be used. Welcome.
Thank you, Ann.
All right, Sten, what can you tell us about this new grant?
Well, funding comes from the CDC REACH program to promote good nutrition and physical activity here in Connecticut. REACH stands for Racial and Ethnic Approaches to Community Health. It's the second consecutive 5-year grant awarded to CARE. CARE stands for the Community Alliance for Research and Engagement and is housed both in Southern Connecticut State University and in Yale School of Public Health. Now, CARE supports community leaders here in New Haven who are seeking to implement community-led health interventions among local residents who've been historically marginalized and affected by health conditions that reflect poor nutrition and inadequate exercise.
What kind of interventions and programs will this CDC funding help?
Well, the bottom line is nutrition and physical activity. So 4 projects are worth mentioning. One expands healthy food choices like fresh vegetables at local food pantries. They've already been working with 10 pantries serving 25,000 clients a year, and now they can include 12 more. A second project is expanding the work of the New Haven Breastfeeding Task Force. This is committed to engaging 79 local businesses in breastfeeding awareness. At least 6 of these businesses are being designated as breastfeeding friendly work sites, and the ambition is to reach many more sites in the next 5 years. It allows expansion of a training program for healthcare providers in best breastfeeding practices to try to help women in Connecticut, particularly women of color, engage in this. And that provider training has a nickname, the Roots of Racial Inequities in Breastfeeding. Third, they're combating diabetes, hypertension, obesity with improved transportation infrastructure planning. You know, and if you don't have proper sidewalks, you're not going to let your kids go out and play. So designing better walking, riding, biking, sidewalk, and transit options in the city is the name is called Safe Routes for All. And finally, they're tackling chronic health conditions and food insecurity with a fruit and vegetable prescription program at local clinics. That's where the health providers write a prescription guiding patients as to what are the healthy foods and particularly fruits and vegetables. And they're starting with Fairhaven Community Healthcare.
And just real quickly, no doubt this relationship is unique. Are there other types of synergy that exists?
Well, honestly, we're really proud of this partnership because it takes 2 of New Haven's fine educational establishments, Southern Connecticut State University and Yale University, and we're working with community leaders and community organizations. Over $1 million since 2018. 19 city residents have been hired in this program, 16 of whom are from the communities that we engage. And this special relation with informed and energized community partners means a lot to those of us in academia.
It sure does. All right, Dr. Sten Vermund, thanks so much.
My pleasure.